Thank you, Edgar. Good afternoon, everybody, and thank you so much for joining us. I also want to thank for their participation today. You'll be hearing in a few minutes from Jessica Altman, from Jessica Wilson, from Sandy Redding, and from Dr. Rachel Reese. But let me set the stage for why we have convened today. 3 weeks from today, Life-Saving Affordable Care Act tax credits are set to expire. Over 20 million Americans will see their premiums skyrocket, and that includes nearly 1.7 million Californians. We're not thinking it might happen, we're not worried that it might happen. We know it's happening because we're in the open enrollment period and people are seeing what the costs of their health care for the next year could look like because these tax credits have not been extended. 4 million Americans could lose their health care altogether because of this spike in healthcare costs, and that includes 400,000 people in California alone. Why? Why is this happening? Plain and simple, it's because Republicans in Congress have refused to get serious about health care, and they refuse to acknowledge that we're just weeks away from a true crisis. This is the same group of congressional Republicans that have refused to negotiate with Democrats to address this. Instead, what have they done? To show you how unserious they've been about this whole conversation, they waited until the 11th hour, literally just yesterday, to put forward a proposal that actually would not even lower premiums for a single American. Instead, what seems to be their objective is to push junk health plans on families across the country while allowing these life-saving ACA tax credits to expire. It's an unserious proposal and it puts lives at risk. Now, for the last several months, many months, Democrats' position hasn't changed. We've been fighting to prevent the premiums from doubling or even tripling in January, which is now just a few weeks away. Because for millions of Americans, that's the reality. Now, earlier today, we voted on a measure that was a straightforward proposal to extend by 3 years the ACA tax credits that Americans broadly support. And not just because it's the right thing to do, but because in 2025, costs are rising on everything from groceries to housing to our energy bills. And yes, when it comes to our healthcare bills as well. And so what they're in effect doing is Republicans are forcing Americans to continue to make impossible decisions between coming up short on your rent or your mortgage, or maybe not being able to afford your groceries for the week, or skipping out on healthcare altogether for the next year. Now, we hear a lot about this from constituents. Just one example of many that have reached out to my office, Rachel in El Cerrito, who fears that when the tax credits run out, that she may have to pack up her family of 4 and move just to afford regular doctor's visits. Now, in the meantime, she's rushing her family to all the preventative care appointments that she can get before the end of the year, when again, the cost of everything will go up significantly. But the clock is ticking. Now, let me take a moment and tell you how I personally know what this feels like. It's been a few years, but I remember when I was in high school getting ready for college in the midst of graduation preparations and college applications, when the restaurant that my dad worked at for decades went from being a union restaurant to a non-union restaurant. What does that mean? When a restaurant or any establishment is union, then the employees are able to negotiate collectively for a good union contract, not just to cover pay, but to cover health benefits. And when the restaurant my dad worked for went non-union, they lost that union contract. And the very first thing to go, not just for my dad, but for all his coworkers, was a good union contract. And to know that from that day forward, my parents had to worry, like, oh, we hope the kids don't get sick. We hope that none of us end up in a hospital because now there's not insurance to help cover those costs. It's untenable for families, and I get it. And so that's why I've been working to make sure we try to address this as Democrats, because affordability is real. But affordability for Republicans, and you listen to Donald Trump's rhetoric, he's calling it a hoax. It's not a hoax. It's a crisis facing so many families across the country. And so here we are. We had a vote that could have helped these costs from rising here just in a matter of weeks. Republicans didn't allow that measure to pass. Democrats will continue to fight to help Americans of all stripes, right? This isn't a red or blue state issue, not a red district or blue district issue. This is an American issue. Democrats today voted to help people keep their health insurance, and Republicans with their votes voted to rip it away from them, and they should be ashamed. So that's why we're here today on this virtual session. I want to turn it back over to Edgar to introduce our next speaker. We'll take questions here at the end of it, but I appreciate you all tuning in. And please know that and I can speak for all my Democratic colleagues here in the Senate, are going to keep up the fight, not just for the next few weeks, but through 2026 as well, until we address this issue.